In this video, I will be discussing the ketogenic diet, a low-carb, high-fat diet that has been shown to have a number of health benefits. I will cover how the diet works, what the benefits are, who should try it, and how to do it. How does it work? The ketogenic diet works by forcing the body to burn fat for energy instead of carbohydrates. When carbohydrates are restricted, the body enters a state of ketosis, in which it produces ketones from fat. Ketones are a type of fuel that can be used by the brain and other organs. What are the benefits? The ketogenic diet has been shown to have a number of health benefits, including weight loss. The ketogenic diet is a very effective way to lose weight. Studies have shown that people on the ketogenic diet can lose more weight than people on other diets. Improved blood sugar control. The ketogenic diet can help improve blood sugar control in people with type 2 diabetes and prediabetes. Reduced risk of chronic diseases. The ketogenic diet has been shown to reduce the risk of chronic diseases such as heart disease, stroke, type 2 diabetes, and cancer. Who should try it? The ketogenic diet may be a good option for people who are looking to lose weight, improve their blood sugar control, or reduce their risk of chronic diseases. However, it is important to talk to your doctor before starting the ketogenic diet, especially if you have any health conditions. How to do it? Here are some tips for following the ketogenic diet. Limit your carb intake to 50 grams per day. This will help you enter ketosis. Eat plenty of fat. Fat is the main source of energy on the ketogenic diet. Get enough protein. Protein is important for muscle growth and repair. Drink plenty of fluids. Staying hydrated is important, especially when you're first starting the ketogenic diet. Sample meal plan. Here is a sample meal plan for the ketogenic diet. Breakfast: eggs with bacon or sausage, avocado toast. Keto pancakes. Lunch: salad with grilled chicken or fish. Keto soup. Keto chili. Dinner: steak with roasted vegetables. Salmon with asparagus. Chicken with cauliflower rice. Snacks: almonds, nuts, seeds, hard-boiled eggs. Cheese. The ketogenic diet is a powerful tool that can be used to improve your health and well-being. However, it is important to talk to your doctor before starting the ketogenic diet, especially if you have any health conditions. Here are some additional tips for following the ketogenic diet. Start slowly. Don't try to cut out all carbs at once. Gradually reduce your carb intake over a few weeks. Listen to your body. If you feel tired, dizzy, or have other side effects, talk to your doctor. Get enough electrolytes. The ketogenic diet can cause you to lose electrolytes, so it is important to make sure you are getting enough. You can do this by drinking electrolyte-rich beverages or taking supplements. The ketogenic diet can be a great way to lose weight, improve your blood sugar control, and reduce your risk of chronic diseases. However, it is important to do your research and talk to your doctor before starting the diet. If you are interested in learning more about the ketogenic diet, I encourage you to do some research online or talk to your doctor. There are many resources available to help you get started.